Nivolumab plus ipilimumab in lung cancer with a high tumor mutational burden. UCSG Dr. John Moscoso. Well, here we're going with the definitions. Starting with what is lung cancer. It is a cancer that starts in the cells of the lung. A cancerous malignant tumor is a group of cancer cells that can grow into and destroy nerve tissue. It can also spread, metastasize to other parts of the body. When cancer starts in the lungs, it is called primary lung cancer. The medicines that we are stating here are called Nivolumab. That is a medicine that is used in the treatment of several types of cancer. It belongs to the group of monoclonal antibodies. It is a programmed death receptor 1 of the T lymphocytes. Ipilimumab is a medication indicated for the treatment of advanced melanoma in those patients in whom the disease is widespread or other treatments such as surgery have failed. Ipilimumab is a human monoclonal antibody that is obtained by recombinant DNA technology. Here we've got a video. What is combination therapy?
Combination immunotherapy is best understood by picturing a car at an intersection, and in front of that car there are 3 or 4 traffic lights, and all of them have to turn green for the car to be able to progress through the intersection. With immunotherapy, there is an immune cell sitting inside the cancer's tumor, and it needs a green light, or perhaps more than one green light, to be able to attack what's in front of it. The drugs that we're giving to patients now are green lighting the immune system.
That's basically what we're doing here, is to remind immunotherapy, and also radiotherapy and chemotherapy to treat this kind of cancers, like the lung cancer. And as pros and cons, the progression-free survival among patients with a high tumor mutational burden was significantly longer with nivolumab plus ipilimumab than with chemotherapy. That's a pro. The 1-year progression-free survival rate was 42.6% with nivolumab plus ipilimumab versus 13.2% with chemotherapy. And the median progression-free survival was 7.2 months. That means 95% confidence interval, 5.5 to 13.2 versus 5.5 months has a ratio for disease progression or death. The audited response rate was 45.3 with nivolumab plus ipilimumab and 26.9 with chemotherapy. The benefit of nivolumab plus ipilimumab over chemotherapy was broadly consistent within subgroups, including patients with PD-L1 expression level of at least 1% and those with a level of less than 1%. The rate of grade 3 or 4 treatment-related adverse events was 31.2% with Nivolumab plus ipilimumab and 30.1% with chemotherapy. Here we've got a video and applications in medicine. Nivolumab plus ipilimumab showed promising efficacy for the treatment of non-small cell lung cancer in a phase 1 trial, and tumor mutational burden has emerged as a potential biomarker of benefit. In this part of an open-label multi-part phase 3 trial, we examined progression-free survival with nivolumab plus ipilimumab versus chemotherapy among patients with a high tumor mutational burden. Another video that we're explaining how is this cancer treated with different methods. The issue applied in Ecuador is that this medicine has been recently introduced in our country for many kinds of cancer, like Hodgkin's lymphoma and squamous cell cancer of head and neck. These indications are in addition to those already present in the drug in advancing melanoma, non-small cell lung cancer, and renal cancer. In concluding, progression-free survival was significantly longer with first-line nivolumab plus ipilimumab than with chemotherapy among patients with NSCLC and a high tumor mutational burden irrespective of PD-L1 expression level. The results validate the benefit of nivolumab plus ipilimumab in NSCLC and the role of tumor mutational burden as a biomarker for patient selection. Thanks.